Okay, so the title is a mouthful, but that's that's known in our field. My name is Alexandra Dongala. I am the Women Health Coordinator at the Philadelphia Department of Public Health and Ambulatory Health Services. So I primarily work with women with living with HIV, yeah. That's it. And I love gardening. I don't know. Go ahead.
Hi, everybody. My name is Alexa Primavera. I work alongside Alex at the PDPH as well as an HIV program assistant, something that I've been doing part-time for the past year, but my main role is an MD, MPH dual degree student at Drexel. So I'll be finishing that up actually in a couple of days, and then I'll be moving out to Pittsburgh actually on Saturday for my OBGYN residency. But I have a real passion for women's health and especially marginalized communities. So it's really exciting to be here today.
Awesome. So I will share my screen so we can get started. Share. Did I do that? All right.
Looks good.
Looks good. Okay, perfect. All right. Okay. Okay. All right, so the agenda for today, so we'll just go over the objectives of this webinar, a little bit of background, what we do, a SHE program overview, let's say SHE stands for Sisterhood for Health Equity, our bundle intervention, we'll go over some preliminary data, photo voice. We did 2 photo voice. We'll explain the differences, 1 and 2, lessons learned, conclusion, and then we'll end right after that. So excited about this. So the objective for today is to develop strategies from best practices that will engage and assist community stakeholders in strengthening their practices, understand the importance and impact of bundle interventions that include self-efficacy, understand the critical dynamics involved in creating a bundle intervention that advances health equity and improves health outcomes for Black women living with HIV. So a little bit of background just to place the importance of talking about this topic is that Black women are significantly impacted by the HIV epidemic, and that 60% of new HIV diagnoses, or they account for 60% of new HIV diagnosis in the US, according to the CDC in 2018. And the rate of new HIV infections among Black women is 11 times that of white women and 4 times that of Latina women. So that clearly just sort of exposed the importance of sort of targeting that particular population. So to give you a lay of the land, the Department of Public Health, we work under the Ambulatory Health Services, which is the biggest provider of healthcare services in Philadelphia. In 2022, we served about 952 patients living with HIV. AHS is currently has 8 FQHC, which stands for Federally Qualified Health Centers, and FQHC lookalike, tongue twister. And a lot of our work is been in improving linkage to HIV primary care, but as well as retention in care. We do provide a myriad of services, such as dental services, laboratory, pharmacy, radiology, family planning, and GYN services. also COVID-19, obviously. So, as mentioned before, so we served 952 patients living with HIV, and within that population, most of our population are Black at 82%, followed by white 5%, Hispanic 9%, Asian 3%, and then the rest are 1%. Gender wise, most of our population are males, 62%, and female 38%, with the other sort of transgender male to female 1%. And our age breakdown is that our population is mostly comprised of folks age 45 to 64. Of 56%, and then 25 to 44, 26%, and then 65 and older, 17%, and then our very young sort of bracket, 1 to 24 is 1%. 80% of our patients are 100% and below the federal poverty level. All right, so let's get to the fun stuff. So the SHE program overview, and as stated before, SHE stands for Sister for Health Equity, and it is a 3-year initiative funded by the Minority HIV/AIDS Fund in collaboration with HRSA. And there are the special projects of national significance programs, so we'll say SPINS. And SHE is one of 12 demonstration sites selected to design and implement and evaluate the use of bundled interventions to improve HIV care and treatment for Black women. And I'll explain a little bit more about what those bundled interventions are. So this is our SHE program criteria. So to be part of the SHE, you had to identify, self-identify as cis or transgender female, self-identify as Black. You must be living with HIV, especially if you're newly diagnosed, super utilizers of healthcare services, and that's defined as having at least 2 emergency department visits, 1 hospitalization within 12 months, struggle to adhere to the HIV care continuum. It has had 2 more missed HIV primary care appointments within 12 months, but also targeting those women who are out of care or lost to care. So our program, the SHE program goals. So we have about 6 goals. First one is improve health outcomes for Black women with HIV, remove barriers and stigma, build trust through trauma-informed care, which I will explain in the next slide, provide health and wellness education, enable access to digital tools for patient connection, reach Black, cisgender, and transgender women of Hispanic or non-Hispanic ethnicity. So this is our bundle intervention. So you may have wondered what a bundle is. A bundle is a structured way of improving the processes of care and patient outcomes. So bundled intervention are a package of evidence-based practices when implemented collectively have been proven to improve patient outcome. So here we have 3 processes to our bundled intervention. So the first one at the bottom is the red carpet care. which is intensified clinical and social support for the healthcare super utilizers. And it essentially consists of a team led by a certified nurse practitioner and a licensed clinical social worker dedicated to our program participant. And then we have trauma-informed care, which is essentially, it's a guiding principle that's embedded in every aspect of our program, and that we recognize that we identify trauma, but we recognize trauma, and then we also understand the path to recovery, but also we actively actually try to not re-traumatize women. So that may be in our interaction with them, and just making sure that their needs are attended to. And then we have a Primetime Sister Circles, S. It is a 12-week wellness program intended to reduce health disparities and improve outcomes. So a little bit more about the Primetime Sister Circles. It is a program of the Gaston and Porter Health Improvement Center, or GPHIC, in collaboration with the Black Women Health Alliance. It was originally developed to address hypertension in Black women 40 to 75 years old. But we adapted sort of the PTSD in that one, we went to virtual versus in person, as it was originally intended to be due to COVID, the COVID measures, and we sort of expanded the age to include all women of all ages living with HIV. Additionally, we noticed, so we had two iterations of the Primetime Sister Circle, and the first cohort, we noticed that there was a lot of dropout due to unfamiliarity with technology. So we included a tech manual, and that tech manual was essentially how to get on Zoom, how to use the tablets or Google Chrome that they received as participant of the Primetime Sister Circle. So that was a, what's the word? It was a incentive, I guess, to be part of the Primetime Sister Circle, and that they would receive and keep their tablets. 6 graduated in the first cohort and 3 graduated for the second one. So a little bit of preliminary data. Again, that data is not for quotation or publication, because we are still in the midst of collecting and cleaning the data. So we are at the tail end of our 3-year grant from HRSA, and we stopped recruiting in January. And this is just a quick snapshot of our population. So we collected data at baseline, 6 months and 1 year. 46 completed a baseline interview, and very much reflective of our population. Most of the women that were recruited are 50 and older, so a bit older population at 64%. And then just that middle bracket, followed by that middle bracket, 30 to 49 years old. Again, because it's targeted for women who self-identify as Black, all of them identify as Black, but with 3 additionally identifying as Hispanic or Latino. Where am I? Okay. And then, so this one we were looking at sort of virally suppression. So it looked at education, where women who had post-high school education were virally suppressed compared to the population with a bit less education. That's on a 53% or 54%. And one of the reasons that I wanted to include like that specific data on virally suppressed is that I think that Black women are and have often been forced to experience like weathering, which is essentially the idea that chronic stress due to their roles as due to their roles as nurturers and breadwinners lead to negative health outcomes. So there's this sort of like superwoman role that is like imposed to them, which is like both positive, right? Because they're there, they're taking care of the family, they have things to get done, but more often than not, it's also very much a liability. Because there is like those stress related behaviors that comes with it. So that could be engaging in unhealthy eating behaviors or lack of self-care, which can be demonstrated by, for example, not taking the HIV suppressing medicine. So when we look at this data, baseline, so looking at, are you currently a caregiver? Are you currently a caregiver for another person? And looking at their virally suppressed, that tongue twister, we'll say that if they're not a caregiver, they're virally suppressed at 84 or 85%, with a count of 28. But for those who are caregivers, only 33% are virally suppressed, which is not a surprise, I guess. And then looking at 6 months, 6 months later, what we're seeing is that women who were not, it didn't really change much. So women who are not caregiver were 84% virally suppressed. And then at the 6 month, women who were caregiver, only 1%. So nothing really changed, which kind of show that being caregiver has some stress related impacts on whether or not they are virally suppressed. But again, this data or these figures are expected to change as we're still cleaning and collecting the data. So just a little numbers for you all. So next is our primetime sister circle outcomes. So of the women who attended the primetime sister circle, the women who attended were very active in those workshops, in those 12 weeks wellness classes. There was a lot of support, women supporting women, which is what we want. Supporting women who were facing mental challenges, who were facing physical health issues, or even like Wi-Fi connection, right? So women who couldn't get into Zoom. So we had other women calling that same woman like, hey, do you need help? What can I do? And also women like facing very, difficult health challenges, but still making the commitment to show up to class. So we had Miss N, not her real name, showed up 1 week after being hospitalized. So that's telling you that the primetime sister circle really was a positive impact on them, or had a positive impact on them. Some women adopted healthier lifestyle, so eating nutritious food, eating less fatty food, but also like maybe doing daily exercise, walking every day. I know there's like one woman who, well, two women, one reported like losing weight, right? So she's like, I lost like 4 pounds. That's great. And then there was like one woman who, prior to being part of the Primetime Sister Circle, had trouble losing weight. But then once she joined a Primetime Sister Circle, consistently lost weight. So that's definitely a win. So yay, kudos to us. And many of the women will like another Primetime Sister Circle because they loved it so much. So right now we're sort of working on some sustainability and see how can we provide a Primetime Sister Circle, again, knowing that our funding is ending essentially. So that's the hard part of providing some of those programs. But also as a parting gift, they received a book written by Drs. Porter and Gaston, who are the author and creator of the Primetime Sister Circle. There's like one woman who, I mean, all of them really rave about the book. So every time we talk to them, they're like, oh my gosh, like I've read this book, it's great. There are great tips on like mental health and hypertension and so forth that they have applied in their daily lives. So that's great. And then next, I want to pass the mic to Alexa.
Thanks, Alex. So hi, everybody. For those just joining, my name's Alexa. I'm happy to be here. We're going to be transitioning a little bit, talk about a couple projects that were just completed in the SHE program as a whole, as well as specifically Primetime Sister Circles. And they were both Photo Voice projects. For those of you who may not know what a Photo Voice project is or need a refresher, it's a qualitative research tool that really connects with participants. And it's a participatory process where participants who are challenged by a certain health condition that researchers are interested in studying are given a prompt, a question that they kind of ingest and go out into the world and take photographs based on that prompt. And it's their representation and their interpretation of what that prompt is, what it means to have this certain health condition. So they go out and take pictures over a few weeks, and then they come back to the research team and write narratives for those pictures. Why did they take them? What does it mean? How can this improve health outcomes for them in the future? Kind of things like that. So it's a really wonderful like participatory process. And so we did 2 of them. The first one that I'm going to talk about is the first Photo Voice, directly involving the ladies of the Primetime Sister Circles. And the prompt for this was honoring and empowering Black women living with health problems through self-portraits. What does it mean to you to be centered in care? And so that was kind of the theme that they were given at the beginning of their particular study. Next slide, please. So this was the timeline for that first Photo Voice, and it's actually, it was led by Alex, so she should be very proud of this. So the first session was in about mid-January, where what a Photo Voice was reviewed with participants who were recruited through Primetime Sister Circle, and the expectations for the project and how they would be compensated and kind of the week-to-week expectations for them. Session 2 was after they took their photographs, so they were given about 5 or so days to take their pictures. They were self-portrait pictures, so they can easily do it with like camera phone or like iPhone that they had available to them. So that second session in the last day of January was the beginning of the discussion of the photos and the experiences the women had taking those self-portraits. 2 weeks after that, the team sat down again with the participants where they actually wrote the narratives for the self-portraits that they took, how they felt while they were taking them, what does it mean to be centered in care for them, Primetime Sister Circle specifically, how that impacted them, and their HIV and their chronic conditions, even surrounding HIV, their comorbidities. And then a few months later, actually just last Friday, we had the exhibition of the photographs where the participants were invited, and it was actually a joint exhibition between this Photo Voice that I'm discussing now and the second one that I personally ran with another set of ladies from the SHE program in general. So it's a really wonderful project. Next slide, Alex.
Mhm.
So in the narrative discussion, the research team had recorded and wanted to document some common themes that the ladies of Primetime Sister Circle in this project had expressed during discussing their self-portraits. And these are the themes that were discovered. So comfortable in one's own skin, control of one's situation, faith was a large topic discussed, confidence in oneself, dressing up brings joy to many of the participants. Some of them discussed struggling with self-esteem, and a lot of the discussion was also revolved around empowerment through these self-portraits. So this project was wonderful, and it had multiple successes, one of which that of 9 of the women who were recruited to participate, 4 of them completed the project, which is not an easy feat over months and weeks and taking pictures, and it's a very involved process. So we're really proud of the 4 women who were able to complete all the steps needed. And of those 4 women, we received about 11 pictures to discuss and be included. The women also talked a lot about how very cathartic it was going through the pictures with one another. A big part of the process was not only describing their own pictures and how they felt, but also describing what they saw in another participant's self-portrait, and that cross-communication and connecting through levels that they hadn't had before with this particular person was very cathartic and really lovely for them. So it was nice to hear that. And like I alluded to, it strengthened those bonds that they had already made in Primetime Sister Circle. So it's just an extra step for them to get closer as a team. No project is without its challenges. So a couple for this particular photo voice is that some of the women had difficulty relating their question to the photographs, particularly because they were self-portraits. So the team really had to be flexible with that. The original photo voice prompt actually included the term HIV instead of health conditions or health problems. And the women were not comfortable with that due to the stigma next to HIV/AIDS, those terms. So the researchers also had to be flexible, and actually they wound up changing the prompt to say, I think, believe health conditions or health problems instead of the term HIV. Go ahead, Alex.
Mhm. 1 second. Yeah.
So these are just a couple narratives of the many that were recorded during those narrative writing sessions after looking at one's individual photographs and then other people's other participants' photographs. And I'm going to read you these right now. The first, and we got permission from these ladies to use their names as well. There was a release form and everything. But Miss Williams had stated in discussing her photograph, it reminds me that I have so much more life to live, no matter how gray life can get. Currently thinking about my life has been hard, and trying to look onto the upside of it has been tiring. Yet the saying goes, God doesn't give us too much to bear, or something like that. I never could get motivational quotes correctly, and like life, I haven't gotten anything correct. It's the willingness to keep going that is one upside to life right now. So really pulling into that idea of faith that pushes them forward, and kind of that narrative that she has in her own life. Miss Elam also had said in relation to her photograph, how do I feel about me now compared to 10 years ago? Well, I have come a long way from 10 years ago. I've always taken care of other people and not myself. Back then, I could never say no. Now I have grown to say no. I have learned to take care of me and not worry about everyone's problems. I hope that in the next 10 years, when I reach 80 years, I will be more at peace. I just want to travel somewhere. I want to go to Hawaii. So that more of like that empowerment in oneself and doing what's best for you were those themes that kind of came through for Miss Elam. So putting the first photo voice aside, we're going to talk about the second photo voice that was being conducted kind of congruently at the same time, but with a totally separate group of ladies. And they were recruited from the SHE program as a whole, not specifically Primetime Sister Circle. And the theme surrounding this particular photo voice was demonstrating the lived experiences of Black women living with HIV in Philadelphia. So really honing in on the HIV as a diagnosis and what that translatability and the intersectionality between being a woman, being HIV positive, and being Black in this city is. So this is the timeline for the second photo voice, and I've included the prompt up top. And what I asked the ladies of them is, what have your experiences been as a Black woman living with HIV in Philadelphia? That was it. Very broad. They can send me any kind of pictures they like. And the difference between this project and the first one is that these weren't self-portraits. I kind of gave them this prompt during the first session at the end of February, after I explained what a photo voice is, what their expectations were for this project, how would they be compensated for their time. And then I kind of let them out into the world for about 4 to 5 weeks and let them take pictures of whatever spoke to them related to this particular prompt. And that could be anything they want. And you'll see, oh, you won't see, I haven't included any pictures, but there was a wide variety of pictures that came back to me. Anything from being outside and these beautiful murals that spoke to them or surrounding Philly to things in their own home that spoke to them. So they had 4 to 5 weeks to take those pictures and send them to me. And then we met again over Zoom. The first session was on Zoom. The second session was also on Zoom to discuss the photos that they took in a group setting and their experiences taking them and why they took them. Why did those particular photos relate to the prompt that was given? And then I transcribed those in real time for the data analysis portion before the exhibition that we had on Friday. So that data analysis phase took a while, but it was essentially a way to discover themes in the project. And I particularly used a thematic analysis, like going through the transcript and coding the particular things that the women were saying to gather the themes. So the themes that I found in this particular photo voice were faith. Again, that was a big thing for many of the women, just like in the first project. Family support really came through for these women in this project. Hopelessness, reach out for help, which was essentially many of the women had described kind of into an unseen audience of others living with HIV or maybe even unsure if they're HIV positive, just pleading to them to get help and to reach out to their doctors, their family members, to not go through these things alone, which was I thought was a really interesting aspect of this project. And then resilience was a large factor for many of these women, overcoming their initial diagnosis and the lifelong resilience that they'll have throughout this chronic disease. So again, many successes. We also had 4 women who completed the entirety of the sessions that were required in both photo voice sessions, meaning like session 1 and session 2. And same thing, we actually got 11 pictures as well from these 4 women. So it's kind of eerily similar. And then all 11 pictures were discussed in the narrative writing session and transcribed. Similar kind of story here. A lot of women commented on how they felt seen and supported by participating in group discussions with those in very similar situations. And several themes were identified, like I mentioned, after thematic analysis to serve as a starting point for future research, either mixed methods or going into the quantitative portion of a lot of the narratives that the women were describing. Again, some challenges. Retention was a large challenge in this project. Again, photo voice can be very time intensive for participants. It's very participatory. So there's a lot to ask of these ladies, especially, if they have jobs, children, if they have grandchildren. So we actually recruited, we had 15 initially interested in participating in the project, all from the SHE program. 10 actually completed that first session, and then about 4 completed the entire project. So retention was definitely a big issue. And I'll get into it next, but lots to do with like scheduling conflicts, other priorities in folks' lives, even some emergencies that had kind of popped up during the process. So definitely those were the 2 biggest issues. Something that I noticed, especially having these sessions over Zoom, was that it made it more convenient for a lot of the women, but you can also kind of tell that there was that digital divide. Like a lot of the participants were a bit older and had never used their smartphone to go on Zoom, or some of them didn't even have a laptop. So it was a challenge to have to coach and mentor them into how to even just get on the session, which took up a lot of time. And the last challenge I would say is manpower. By my own choice, I took this on as my master's thesis. So I was running this whole photo voice by myself. I don't recommend that. I would say that you definitely need, if somebody wants to repeat this, you definitely need a lot more manpower instead of just one person trying to control everything. So that was definitely a big challenge, but one that I kind of put on myself. So as far as dissemination goes, like I mentioned, we had a joint gallery exhibition just last Friday on June 2nd at a very busy federally qualified health center in Philadelphia. And it was available for anybody passing by. We had a nice table set up of all the pictures from both projects and with some light refreshments. So anybody can just come by, ask about the pictures, understand a little bit more about the experiences that all these women went through, whether it was the self-portraits or the experiences living with HIV in Philly. And it was really lovely. It was open to providers, staff, anybody just kind of bopping around in the health center and wanted to just stop by and ask some questions. And then the participants also received their own personal invitations, which you can see here on the right. So they can be able to be a part of the dissemination process and see how much of their hard work went into this. So a few of them did show up, and it was really lovely to see them there. And then as far as dissemination for more of like a research-oriented thing, the second photo voice has been accepted for poster presentation at APHA this November. So if you're going to be there, you'll see me there, and we can talk a little bit more about that second photo voice and what the results were. And these are just some pictures of the gallery day at the health center. It was really beautiful, and yeah, everyone had a great time. And that green table all the way on the left had just really yummy sandwiches made by our boss. So it was a really nice time.
Yeah.
So some recommendations slash lessons learned. I kind of talked about this a little bit, but the biggest one is over recruit. If anybody wants to repeat a photo voice, especially with a marginalized population that has a lot of challenges outside of health, like socioeconomic challenges, social challenges, our recommendation would be to get as many people as you can, at least interested in attending those sessions. We were a little bit hindered because we only wanted to recruit within our own program. So Alex had recruited within the ladies who graduated from Primetime Sister Circle, which was a very, very small recruitment pool. And then I had to recruit from the SHE program in general, which you would think would be very large, but it's not as large as you think. So I would say if you're going to do this, try and expand it to more of like the general population. And let's see. So a second recommendation would be work out with the participants whether or not they want to do their narrative writing over Zoom versus in person. If I had to do this all over again, I think I would choose to do it in person. I think it just would have flowed a little bit more easy. And especially with the ladies who had troubles logging on and getting on Zoom. And yeah, so I would say make a note of that and just ask your participants what they would prefer doing instead of saying, here, we're going to do this on Zoom, because that might not be the most ideal situation for many folks. Just like in the first photo voice, where the researchers had to kind of pivot their research prompt and exclude the term HIV or AIDS, be flexible, be willing to make those changes if your population isn't as comfortable with that particular project's prompt that you were expecting. And like I mentioned, I would say have at least 3 researchers helping you with this project, especially if you're going to do something over Zoom. If you want to like transcribe or somebody else facilitates the projects and the team, I think it's just more feasible if you have at least 3 people rather than just 1 or 2. And I think Alex can second that. Yes. We had her and one other person. And then another recommendation would be have a solid timeline before recruitment, so you can really give those expectations to your participants in writing, clear cut, like you're going to be meeting with me this month at this time and this month at this time. And if you have to make changes along the way because of emergencies or family obligations, you can do that. But I would say have a pretty solid timeline before you even start recruiting. So these are just some general conclusions on this, not just photo voice, but this whole project, the bundled interventions. So bundled interventions have the potential to improve the quality of life and HIV management of Black women. We're still cleaning and collecting data, but that's where the trend has been going. And it really is a positive direction for the reduction of healthcare inequities in Black women living with HIV. So this is definitely something that should be looked more into, and we're really excited to see what the final results are for this particular project. A mix of quantitative and qualitative data is ideal for describing the challenges and lived experience of this particular population. I think having that kind of mixed methods research approach is ideal. Getting that quantitative hard data that you can kind of consume very easily, but also having those narratives of the photo voice and that qualitative aspect of these projects, I think adds a very humanistic touch, and you can kind of connect the two and get a better idea of the experiences that this population is having. And then future research can expand on bundled interventions for trans women to reach a more marginalized subpopulation of Black women. Part of the recruitment was to recruit some trans women, but I don't think we recruited as much as we had hoped. So I guess our hope for the future is to really focus in on that specific population and really kind of study and try and help that particular population that is still severely affected by HIV and a lot of healthcare inequities. I think would be really lovely to do in the future. Yeah, and this is our contact information. Me and Alex, you can reach us anytime. That's actually my personal cell phone. So feel free to text me if you have questions. And yeah, it was a pleasure speaking with you.
Thank you.